So from the Valproate response team then a decision was made to the best way to communicate to people was to correspond with them, both to firstly their GPs and then individually. I guess in Ireland we're lucky that we could consider this option, and the reason why is because people do receive their medications free through the long-term illness or with the GMS. Now, neither of these schemes were ever set up for the functionality to actually recall people with their medications. So the robustness of them is not complete, but it was as good as we could find to identify all women who are currently taking Valproate. Just to reiterate the HPRA communications, there was a pre-alert sent and then a post-alert sent and then a customised letter sent to each GP with a time frame to allow them, invite them back into the surgery to review their care. And then a couple of weeks later, each individual woman received a letter or the carer of the person if they had an intellectual disability. And then the telephone support opened through the support of the communications office. And like what we've heard earlier today, a lot of those telephone calls were very raw, very upsetting, and frustration from the themes of the calls were very loud from people trying to access services. That stayed open between July and October to receive those calls, and certainly even though the telephone support is closed, we across the country still want to hear from people who've previously been exposed with prior exposure in pregnancy. In setting up the telephone service, there's a big network of epilepsy nurses across the country, and they supported this piece of work and were available. And the volume of calls were unpredictable. There was just under 3,000 letters sent out, so we had to be prepared to receive 3,000 phone calls. So it took their support to be there in case that volume increased. And it wasn't my ears or my voice that you heard at the other end of the telephone. It was my colleague Yvonne Owen, who was released from Epilepsy Ireland in order to support the liaison service. And I guess why we set it up was we didn't want people receiving a letter and learning about the concerns in black and white, that they had some backup service if they had any concerns in order to be able to get specialist advice. So it just began on the 30th of July, and overall we received actually 57 calls. Some of them were repeat, and you can see the source of the contact. And the people told us that they either were calling because they had received a letter, they had learned about the liaison service through the Twitter or Facebook from Facts and Oaks, whether it was an online or whether it was through their GP. There were predominantly, out of the 57 calls we received, from women who were currently on Valproate or had been previously on Valproate. There were a small amount of relatives and some healthcare professionals. And there's quite a spread across the country. You'd expect to see a higher incidence in Dublin, the next one then in Cork, and then in Meath. But it widespread across the country we received calls. So as I said, we received 57 calls, and 38 of those 57 calls were from people who are currently on Valproate. 3 of them were men with also concerns about adverse effects, and 16 of the women had pregnancies and previous Valproate exposure. There was 2 letters sent in error, which just reflects that the LTI and the GMS scheme is not the robust way to recall, but the only way that we had. And all women who contacted the line, if they hadn't previously accessed counselling, were offered counselling. The number of children with definite fetal valproate syndrome from those callers were 3, but there was 41 other cases with suspected symptoms of fetal valproate syndrome, and they were broken down into 30 under the age of 16 and 11 over the age of 16. And then there were 2 other women who had not been exposed to valproate but with other anti-epileptic drugs, and 1 unsure if they were exposed to valproate. So just in that diagram, just from the calls that we received, once again there was 41 with suspected fetal valproate syndrome, 3 on other anti-epileptic drugs, and then 3 with a confirmed diagnosis. So we identified that there were a number of people who were not attending a neurology service and required access to one. So 28 of the 57 callers were already in neurology services, well, broken down into 22 in neurology and 4 in psychiatry. We identified that 12 were not attending any specialist, either in psychiatry or in neurology, specialising in valproate prescribing. So 11 of them required access into neurology and 1 required access into psychiatry, and you can see where they're spread out. And then 8 did not apply to requiring further access because 3 were seizure-free and off their anticonvulsant medications, and 5 were under the care of a GP and didn't wish to be referred for a psychiatrist service. And as Alma mentioned earlier, we are now have all received the tools to enable us to implement the recommendations of the HPRA, some of which are in your packs. They include a patient guide, a guide for healthcare professionals, there's posters in pharmacies, and then you have all seen the warnings on the Epilim medication boxes. Professor Green mentioned this pathway earlier today, and it's just a simple one-page sheet directing GPs on the pregnancy prevention programme, how to access specialist services, how to access counselling, which is free of charge whether you're a medical card holder or not, how to access for a suspected diagnosis through the Crumlin Genetic Service, both for paediatric cases and for adult cases. And here's where we're at really with the prevention pregnancy programme. This is what's going on in the ground, the beginning of the registrations and the beginning of the continuous annual reviews. So in the first quarter here, we're identifying all women currently on valproate going through our outpatient clinics. And these are all women between the ages of 8 and 55, ensuring that valproate is appropriately prescribed, ensuring that they receive the prevent leaflet, and whether or not their medication needs to be altered, discontinued, or switched to an alternative appropriate anti-epileptic drug. We're also trying to identify women who were previously on valproate, and we'd often go through prior medication at our OPD reviews. There's a discussion then on the health of their children and whether there is any neurodevelopmental delay with those children, and identifying then the need whether or not they need to be referred to diagnostics in Crumlin and making those recommendations to primary care. At those clinic appointments then the risk acknowledgement form is being completed, and really this is the way then we continue this assessment by giving a copy to the GP and a copy into the medical record, and then we're holding on to a copy for audit purposes, which identifies also that annual review. Unfortunately, this is manual at the moment, but we are hoping through the valproate response team to get this all electronic, to be able to ensure that we can demonstrate that we are implementing the HPRA recommendations. So this is going on throughout every neurology clinic currently, and we will endeavour to continue to identify and implement all the recommendations of the HPRA.